Speaking of blending in, it's early. You're probably sipping on your first, maybe second cup of coffee. You're blending lots of sugar into your tea. That's not what we want you to do. You may want to rethink what you put in that drink. WNCN medical expert Dr. Kevin Campbell, he joins us now. Good morning, Doc. Good to have you here. We're talking type 2 diabetes, really at epidemic proportions in our country. What is the big difference? A lot of people always ask between type 1 and type 2.
So type 2 diabetes occurs when our body makes insulin, but our cells can't really respond to it. Insulin is critical in allowing us to use the sugars that we eat in our diet and move them into cells for energy. In type 1 diabetes, your pancreas, or the organ that makes insulin, doesn't work, and you no longer have the ability to produce insulin. There's 26 million people with type 2. Of all the people who have diabetes, only 5% have type 1.
So with type 2, we talk so much about diet. How closely linked is diet to type 2?
It is essential to avoid type 2 diabetes by diet and exercise. If you maintain a healthy body weight, you exercise, you eat wisely, you can certainly reduce your risk of type 2 diabetes.
Are there certain people who are more predisposed to type 2 diabetes? Because you hear folks say, oh, I got thyroid issues, you know, I've got big bones, and I'm just predisposed to being at a certain weight. Are there excuses? I don't want to classify them as excuses, but certainly predispositions.
You know, in type 1, there's a genetic component. It's almost entirely genetic with an environmental insult and an autoimmune type reaction. In type 2, certainly people who are overweight have larger body mass indexes and have a certain high-fat diet are more prone. This new study that just came out showed that if we reduce our sweetened drink consumption by 1 drink a day and also drink coffee or tea without sweetener, we can reduce our risk of type 2 diabetes by 25%, which is pretty profound.
Wow. And talk about some of the ramifications of having type 2, because really, I mean, the spectrum is endless, isn't it?
It really is. When you have diabetes, it's all about managing your blood sugar because the complications can include blindness from damage to the eyes, kidney disease, certainly heart disease. You know, a lot of my patients have diabetes. On a personal note, my daughter has type 1 diabetes, and she has an insulin pump and does a wonderful job controlling her blood sugar, and that's the way you avoid complications of diabetes down the road.
Yeah, but since it's preventable, type 2, you just got to get that diet and exercise under control.
Exactly. Work with your doctor every day to make sure you're doing the right things.
All right, always great info. Appreciate it, Dr. Kevin Campbell. If you've got a question for our medical expert, Dr. Kevin Campbell, just ask him. It's really easy. Just log on to our website, WNCN.com. Search links that we've mentioned. You can find Dr. Campbell's website, his Facebook page, and Twitter account as well. He's accessible, and he will answer you.
Absolutely.
All right, thanks.